Welcome to this explainer. You finally did it. You made the call. That first mental health appointment for your child is officially on the calendar for next week. And honestly, if you're watching this right now, it is completely normal to be feeling a really complex mix of emotions. You're probably feeling immense relief, a healthy dose of fear, and this intense pressure to explain absolutely everything perfectly to a brand new doctor. I bet there's a folder sitting on your kitchen counter right now just filling up with report cards, medical records, and pages of those frantic late-night notes. We get it. And right in the middle of all that chaotic prep, your child looks up at you and asks, "Are they going to decide something is wrong with me?" It hits you right in the gut, right? Now, as a parent, you might be tempted to just brush it off, to say, "Oh, no, it's nothing." Or you might swing totally the other way and say, "Yes, we need to find out exactly what diagnosis you have." But according to the research, there's a much better way to handle this. Tell them they aren't going there to pass or fail a test. There's no grade here. Instead, explain that they're meeting someone whose entire job is to just understand what's been difficult, what's actually going really well, and what kind of support might help make things a little easier. Okay, let's dive right into this and outline the journey we're going to take to turn all that anxiety into an empowered action plan. Here's our agenda for today. First, understanding the evaluation process. 2, organizing records and history. 3, preparing your child honestly. 4, privacy and safety concerns. 5, during the appointment. And finally, 6, the next step plan. Let's get to it. Section 1, understanding the evaluation process. This is not a pass-fail test. Let's set the stage right out of the gate. A mental health evaluation is a structured process to understand the whole child. It is absolutely not a judgment of their character, and it is definitely not an evaluation of your worth as a parent. The goal here is to understand a current concern, when it started, how it's actually impacting their daily functioning, and what potential explanations there might be. It's not just a quick test that spits out a label at the end. Actually, if a clinician tells you at the end of that first visit that they need more information or they need to see you for multiple visits, that isn't indecision. It's not a bad sign. That is just responsible diagnostic practice. Comprehensive psychiatric evaluations often take several hours across one or more visits. Section 2, organizing records and history. Preparing your one-page summary. So you want to make sure the clinician gets the big picture of your child's life quickly, right? You don't want them getting lost in that massive stack of papers. And this brilliantly illustrates why. A vague summary might just say, "She is extremely anxious all the time." But a concrete summary says, "Missed 8 school days in 6 weeks because of morning panic and stomach pain." See the difference? Providing concrete examples with the actual frequency and functional effects is incredibly important. When you tell a clinician exactly how the problem is affecting school, home life, or sleep, it helps them ask much better questions right from the very start. Next up, you're going to want to build a developmental timeline. Think of it like a quick roadmap. You can break it down chronologically. So 0 to 2 years for things like pregnancy, birth, and early temperament. 3 to 5 years for language milestones and sensory patterns. 6 to 12 years for school transitions and learning history. And then recent weeks, this is for family changes, trauma, or the specific timing of important symptoms. And hey, please don't stress if you don't know the exact precise dates for everything. That's totally fine. A rough chronological sequence is what provides that vital context clinicians need to interpret what's happening right now. To keep everything perfectly organized, you don't want to cover the logistics and medical history first. This means literally bringing the actual bottles of medications and supplements, plus noting any sleep concerns. Then gather up that school information, attendance, report cards, and teacher observations. Notice we say observations, not diagnoses. You want to explicitly ask teachers for concrete descriptions of behavior. And here is a crucial point. Do not forget to list your child's strengths. Bring information on their interests, their talents, the adults they trust. Highlighting strengths is absolutely essential because it prevents a diagnosis from becoming your child's entire identity. Plus, it immediately shows the clinician what is already working really well for them. Section 3, preparing your child honestly. No coaching allowed. How you talk to your child about this appointment matters tremendously. We need to use developmentally appropriate language to explain what the visit will look like, without ever rehearsing their answers. Now, what's really interesting about this slide is the difference between coaching and honest prep. Coaching sounds like, hey, make sure you tell them you cannot focus, but definitely do not mention our argument. Honest preparation, on the other hand, frames it like this. This is a chance to explain what life has felt like from your perspective. Remind them they don't even have to agree with you about everything. Coaching actually reduces the accuracy of the evaluation. And worse, it can make your kid feel responsible for producing the correct result for you.
We want honest participation here, not a rehearsed performance. Section 4. Privacy and safety concerns. Establishing the limits.
Okay, when you finally get to the clinical interview, you need to be prepared for the fact that the clinician might ask to meet with your child privately, especially if they're an adolescent. Teens often speak way more openly when they have that private time. But that requires really clear boundaries. Before the evaluation even officially starts, establish those limits by asking some key questions. What will remain private? What information gets shared with parents? What situations actually require disclosure? And how are safety concerns handled? Clearing up these confidentiality rules right off the bat protects both trust and safety. It ensures your child feels safe to speak honestly, while you know exactly how critical information is going to be managed.
Now, if you are dealing with immediate safety concerns, you must shift your approach entirely. First, securely lock away any lethal means and medicines. Step 2, immediately call 988 in the U.S. for crisis support or 911 for life-threatening emergencies. Step 3, maintain strict supervision and follow emergency professional guidance. I want to be perfectly clear and firm on this. Never ever wait for a scheduled, routine evaluation if there is an immediate danger, a risk of self-harm, severe aggression, or an acute crisis. Immediate danger requires emergency support right now.
Section 5. During the appointment. Let the child speak. All right, imagine we're inside the exam room right now. The clinician is asking questions. Your main job here, let your child share their internal experience without jumping in to correct every single little detail they might get wrong. If your kid says something you completely disagree with, take a breath and try saying something like, I remember that differently. May I add my perspective after you finish? This is such a great, calm, non-judgmental way for you to add your developmental context while still letting your child take the lead. Differences between your reports are actually super useful information for the doctor. Remember, the clinician is also just observing how you and your child interact. Natural interaction gives them way better clues than a family trying to look perfectly flawless. Section 6. The next step plan. What happens after? As the appointment winds down, your goal is to leave with a concrete, actionable plan, not just a head full of confusing technical jargon. To get that, the crucial point is you need to ask the clinician for a formulation. What's that? Well, it's a broad explanation of how biological, psychological, developmental, family, school, and social factors all interact to maintain the problem and guide the treatment. A diagnosis is just a classification, right? It's just a label. But a formulation actually explains the why of what's happening and guides the actual treatment. So always ask for a formulation rather than settling for a standalone label. Just ask them directly, how do you understand what is happening here? Finally, what actually makes a useful next step plan? Well, it should clearly identify the working diagnosis or any remaining questions. It needs immediate safety actions, recommended treatments, and medication decisions. It should outline parent and school involvement and set measurable goals with a specific review date. Make sure you request written instructions and definitely ask who is responsible for each step before you walk out that door. If medication is proposed, ensure you absolutely understand the target symptom and potential side effects. Bottom line, do not leave without understanding who will do what next. So, are you ready to give the evaluator the whole picture? The ultimate goal of all this preparation isn't to hand over a flawless folder or rush to get the fastest label possible. It's to provide accurate, comprehensive information to support the whole child. As you gather those records and sit down to talk with your kid, ask yourself, how can I best present the complete story of who they are today so we can discover the exact right support for who they will become tomorrow? Thank you so much for joining me for this explainer. You are now prepared for today's appointment. But what happens when the evaluation is over and the real work of treatment begins?